Welcome to Empowered Voices, Recovery to Resiliency. I am Amani Wilson, joined by my fabulous co-host, Dr. Farzad Kamyar. Today, we are exploring this complex intersection of substance use disorders and mental health conditions, particularly during pregnancy and early motherhood. Through expert insights, we'll uncover how trauma, depression, anxiety, and other mental health challenges intersect with substance use and why integrated care is essential for recovery. Dr. Farzad?
Yeah, thanks, Amani. We are very fortunate today to have two wonderful guests.
Yes.
What? Yeah. Okay. First, joining us today is Miss Bianca McCall, a retired professional women's basketball player, TED speaker, nationally recognized human behavior expert as well.
Yes.
Bianca brings 25 years of experience in behavioral health and over a decade as a healthcare CEO. Her work focuses on psychological injury prevention and innovative solutions to address dissociation, isolation, and the deeper human factors influencing mental wellness. Bianca's insights are especially critical for supporting pregnant and postpartum individuals navigating co-occurring mental health challenges and substance use disorder. Thank you so much, Bianca, for being here and for the transformative work you do every day.
Thank you so much for the invitation.
Of course. And then our second guest, tried and true, has been on here before.
Yes.
The boss. We talked about this a little bit before. The one-liner is she's the boss person at Empowered, at the Empowered program. She runs the show. Rachel Mack.
Thank you for having me.
Yeah. All right. We're going to kick off. Let's go. So there's this notion that individuals have a substance use disorder, and there's a notion that there's individuals that have mental health issues. I use the term mental health to sort of cover that umbrella, which includes, but traditionally folks think of mental health as things like, PTSD, major depressive disorder, anxiety, bipolar. Bianca, start us off. Do you see that there are connections co-occurring? What are those? How are those? Have at it.
Yeah, I think it's impossible not to look at the connections. First of all, I'm a systems gal, so I'll lead with that. Look at everything being interconnected and everything based on relationships. When we talk about postpartum, especially, I'm looking at the human experience as being kind of a series of separation events. And when we talk about birth, it's oftentimes celebrated and looked at from the perspective of the child, right, bringing a baby into this world. But we rarely look at the event from the perspective of the mother, the birth mother, and what trauma actually occurs in that separation between child and mother. And so when we look at the experiences of the mother, we're looking at a multidimensional experience, meaning there's an experience physically from that separation. There's an experience emotionally, behaviorally, existentially. And that's really where, kind of my jam is. And I'd like to come in and look at the existential as we look at kind of like that loneliness, after that separation and a mother's given birth. There's that emptiness, that loneliness that's very much not understood. There's nobody but a mother that can understand what it feels like to have a child, and be protecting that child for months, throughout the pregnancy. And so you get into this existential isolation where the mother's kind of on this island and experiencing this multidimensionally. And so the loss of connections, with between mind, body, essence, spirits, and spirituality, right? That loss of connection, the only kind of helping and healing that's done is if we reconnect, we reintegrate. And so the connection between the mother's experience and then also when you talk about co-occurring disorder or dis-ease, it's connections ultimately between all of those domains, right? And how we are coping with the separation, from each of those domains. And so going into kind of coping strategies as well, You've got constructive coping, you've got deconstructive coping that kind of undermines, there. And when we talk about substance use, we're talking about destructive coping, right? Those things that kind of eliminate our opportunities to create, to grow, to learn, to be restored. And so it occurs so often because there's this need to cope with this very existential crisis. And oftentimes in mental health, we are, I kind of call it going to going to a fight, with a pocket knife, and then somebody's got like a firearm,
Right.
and when we're talking about mental health or mental wellness, and minus the existential, kind of perspective, we've kind of got our mothers on an island, without kind of the language, without the support to be able to express, how they're internalizing, that separation experience, and so substance use definitely, like I said, it kind of reinforces that isolation, and so and it happens way too often.
It does.
Yeah. I mean, really often. One, holy moly, can we get you on record?
Right.
I would love for, some of the work that I do as well involves this high-risk pregnancy care and actually, providing things like OB, obstetrics, those kinds of things. I would love it if we could get your 4-minute clip and play it for every expectant mother, because it's a lot of times, I mean, you said it so eloquently, whether it's existential, but maybe subconscious,
Right.
conscious. And for those that don't, right, aren't prepared for, and then you talked about supports. Yeah. Okay. Oh, wow. That was so good. Wow. All right. So we know that there's this intersection. Yeah.
Yes.
And I think it was one of the last statements that you made, and it happens often. Do we have any idea how often, in your experience, how often are you seeing these things like dually connected? I'm talking folks that have substance use disorders and those classic mental health conditions, whether it's during pregnancy, pre, during, post, whatever.
Yeah, I mean, I would say it happens all of the time.
Yeah.
I think as far as how often is it diagnosed versus how often is it occurring.
Give us both. I love that. Yeah.
Yeah, I think how often it's diagnosed in my practice, I probably see it, upwards of 70%. And then also when you get into historically marginalized communities, marginalized by race, ethnicity. And then also you talk about the culture of economics, right?
Yes.
So low socioeconomics. And then neurodivergence is also a community or culture that we don't often talk about when we talk about historically marginalized. And so amongst those populations, you see an even higher rate of the diagnosis of postpartum. But like I said, undiagnosed, I would argue and debate till my last breath that it occurs 100% of the time. Because it is, again, from an existentialist lens, it's a separation event that 100% of mothers experience. And when we talk about substance use, we're also talking about, like I said, the intersection with coping, but it's about looking at the function of the substance use, right? Looking at the why, starting with the why. And there is a myriad of whys, for mothers. So you have the existential crisis that's going on. For some mothers, you have the function of substance use being to have energy, to address the hormonal changes and what that looks like for the physical experience. And like I said, multidimensional experiences for body image dysmorphia. I see a lot of substance use, to address the perception of self. And getting into that topic, I mean, that's a rabbit hole when we talk about the power of perception and trauma, right? And so if we're coming from a trauma-informed lens, trauma is an experience of like a deep psychological pain and anxiety experience from actual and perceived, danger. And the perceived part is so huge because our bodies, respond the same exact way.
Our bodies feel it.
Our bodies feel it the same
Yeah.
exact way. And I'm a huge proponent of like the Albert Banduras in terms of self-efficacy and the Joe Dispenzas and looking at the power of influence of our thoughts, influencing our beliefs, and our beliefs influencing our feelings influencing our behaviors, which we get into the substance use, and our behaviors influencing our experiences. And so if we start with thoughts and perception and the inner dialogue, our inner voice is really the conductor of our realities, right? And so if we have our inner voice, the inner voice that's looking in the mirror, I tell the story all the time, looking in the mirror and saying such horrible things, about ourselves in our highest moments of consciousness. I'm ugly, I'm fat, I'm a bad mother, I'm all of these things. That inner voice unchecked, it leads to that toxicity kind of spilling over and influencing our thoughts, our beliefs, feelings, behaviors, and experiences.
Yeah.
That
Agree.
is so true.
100%.
As well.
Right?
I think body
Yeah.
image, that's a really, really big factor that I feel like we do see a lot of that in Powered and have seen more and more of it. And I think that's a really,
Okay, so generally,
good
Rachel,
topic.
that's why I wanted to ask you, sort of reinforcing what Bianca had mentioned. What do you see, like boots on the ground, as far as Empowered is concerned? Folks or individuals that are coming to us, what do you see as far as those with substance use and co-occurring? I'm throwing up air quotes. Yeah,
I would say we see a lot of generational patterns of untreated mental health,
untreated.
for sure. Generational patterns of families being separated, and so the trauma that brings for new moms trying to be an example and bring their baby home and start something new that they've never seen. I would also say for a lot of our clients, especially with our program being a focus of substance use, a lot of our clients have used substances, as we've mentioned, as a way of coping because of their journey or experience of trauma and different mental health conditions that they have that have been untreated. And so because of the substance use, the mental health challenges and symptoms and conditions that they have really just been compounded. And then now we're bringing in from mental health, substance use, and now trying to be a new mom.
Yes.
And all the challenges that brings naturally, regardless of mental health and substance use. But when you're adding those things in addition to, again, those generational patterns, so having that lack of support makes it just 10 times harder.
Yes.
Yeah,
Almost
10
seemingly
times.
10 times
maybe
harder.
conservative.
Yeah,
10 times.
and I think you made a good point. I feel like a lot of our clients, they definitely can feel that it feels impossible. That it feels impossible to do this in a healthy way or what we're saying is supposed to look like. It can feel very impossible for them.
Especially not knowing where to start, where to even begin, especially if you lack the support, not knowing where to even find healthy supports. You have to change people, places, and things, but don't even know where to start, nor do you have the finances to even move from the area that you were once using in to, it's just
and those are all
rabbit.
things for just that impact the mom, but impact the family. So that's impacting the baby. And how many changes do babies go through in that first year, or first couple months? First year alone, there's so many changes that the baby is going through, and needing a mother that is present and able to address those things is really difficult when they're also trying to be healthy for themselves, looking at their mental health and substance use and trying to sustain their recovery. And then you're talking
Doing
about
new habits.
and then all the social determinants of health that also impact all of that. All of that, and so there's a huge connection and a really big challenge for our clients.
Yeah. So sort of approaching it from the number side of things, it absolutely happens, and it happens all the time, to the point where mental health issues, including substance use disorders, are the most common obstetric complication. Obstetric being pregnancy, right? It's the most common. It's not high blood pressure. It's not diabetes. It's not bleeding. It's not having to have a C-section or something like that. It's a mental health issue. What's horrible about that is that we don't do a very good job at identifying, right?
Yeah,
We don't do a
that is
very
true.
good job at addressing. We don't do a very good job at supporting, and it continues all throughout. So the most common thing, and we're not doing all that fantastic of a job with all these changes. Then when you look at sort of each individually, so folks that have a substance use disorder, how often do they have something else going on Bianca, you nailed it. You said basically, let's call it 70%, whatever.
Right.
Let's be conservative and call it 50 undiagnosed. We're approaching 100. Yeah, we're approaching. And then on the flip side is, let's say I have a primary diagnosis of major depressive disorder. How often does something like substance use come into the picture? Conservatively, we're probably thinking a quarter.
Yeah.
But then realistically undiagnosed, what is it? And it's going to be much higher than that. So it's like this. Then you mentioned things like trauma, social determinants, and it becomes this thing. Then you go into like the real medical side of things where there are physiological changes that happen during pregnancy.
Yes.
And I don't know that we find any of them that are protective, which is really unfortunate, right? We're saying take a bunch of stuff that's really difficult, take a bunch of stuff that's inside of you, whether it's generational, whether it's genetic, whether it's environmental, or the whole thing put together. And now let's really mess with your physiology, including hormones, etc., that make it the most vulnerable and the most tumultuous time for individuals.
Yes.
And then we say, let's have you deliver and then potentially have all heck break loose postpartum, because then it really, right? It really. Oof. All right.
lot.
It's a lot. So it's a real thing. We're all in agreement.
Yes.
It's a real thing. And
Yes.
let's kind of assume that it happens to everybody. So we should be looking out for it.
Yes.
Bianca, once we see it, what is an effective, AKA treatment? What can we do to help?
Disruption.
Okay.
Disruption is the most effective intervention in treatment. And I say that to say, and if it's okay, if I come on this show and do a little disrupting, I'm gonna shake some people up.
Love it.
Because to me, it's one thing to say, okay, we're not doing a very good job. You know, it's another thing to say that, you know, our system is flawed and we need immediate disruption of and bridging the gaps, you know, in our services. We need immediate attention to restoring a voice to our mothers, because not only are we you know, coming up short in terms of supporting our mothers throughout the birthing process, we are silencing, you know, our mothers. So they're going throughout their treatment and their care, feeling like, you know, they're not being heard, feeling like their level of pain, their level of injury when it comes to experiencing this separation event, their level of safety, psychological safety, to be able to express their concerns, their fears, where in their lives, in their support systems, in their networks, they are lacking, you know, that support. They are lacking the abilities to be able to, you know, support themselves, fill their cups, and to feed and overflow, which is essentially, you know, what motherhood is supposed to be,
Yes,
right?
the ideal.
And so, so when we, as a system, as supporters, as helpers, as healers, we need to one, I think it's come together and empower, you know, for namesake, empower the systems of wraparound care that we're you know, centering our mothers in, right? So having physicians and working with, you know, the paraprofessionals and the supports, doulas and community health workers, and bringing in more of a tribal community as a collective to be able to support our mothers and to be able to offer culturally responsive care and language that the mothers feel safe in being able to express. And then you mentioned also having the supports. If we're looking at the social drivers of health, having supports, because there might be other children in the home, right? So we need childcare. We need our significant others and our partners to step up and into the role of you know, managing, sharing the load. Sure. And then we also need to look at our treatment systems, where traditionally, you know, historically in healthcare, and then also when we talk about substance use treatment, the system is set up to isolate, you know, those that are in treatment, right? We identify that this person is injured, is experiencing an injury, or you know, having a toxic or dangerous relationships with substances, and we extract them from their systems, their natural environments. We treat them, we rehab, we educate, we do all these things. And then we heal and return them to a system that has already adapted to them being the injurious agent, right? They've already adapted in some of those, what we would call like those dysfunctional roles, where substance use is occurring. Dysfunctional masked as being a hero in the situation, being a codependent family member in the situation. You know, it's masked as these other kind of performances. But essentially, the system is unchanged. And so that's why we see reoccurrence, you know, formerly referred to as relapse, and all these things that is such an integral part of recovery. And the reason why is because our system is based on isolation still. And going back to the existentialist lens, you know, this is an existential isolation is causing this injury and this response, this trauma response to use substances. And so we've got to, I think the focus needs to be redirected into how do we persistently support connection and reintegration, and how do we model that as a system? And so when we talk about treatment, absolutely.
Yeah.
Wow.
What's been your experience, Rachel?
I totally agree with that.
Yeah,
that
right?
it's and what's even more challenging, I think, for individuals that are parenting, that they're also separated from their children when they're trying to get the help that they need in treatment, whether it's substance use, mental health, co-occurring detox, whatever, inpatient, residential. They're often separated from their children, which is a trauma alone. Okay, I got to go take care of myself. But I'm going to miss my child, and I'm worried about their well-being. Who's going to take care of them? Are they going to be okay?
Yeah.
But right now, I'm not okay. So, like, balancing that and needing to get help when having to step away from everything. And then, like you said, integrating back into your family system that hasn't changed, that hasn't got the help or support or attention that is needed. It makes it really difficult for that individual to sustain the coping skills or tools that they've received from the treatment that they just completed, you know, to go back into that, you said that perfectly.
Yes.
To go back into that family system. I mean, and you've experienced that too. To go back into that same environment, and you're the only one that's gotten the help that's needed. But we all need help. There's so many areas that need to be addressed.
And then the icing on the cake, the treatment now, the length of stay is shorter and shorter and shorter. Every time you look around, it's getting shorter. So how much help are we truly giving us mothers, you know? Like you said, it's just
challenging.
A cycle, catch-22, it feels like.
It's a systematic
I mean,
challenge.
we see it all the time. Yeah, we see it all the time. There's a notion, and I'll say more so with substance use and mental health, but substance use in general, compared to, you know, medically we think of those as just chronic illness. Yeah, chronic illness. So I hold it the same level that I do diabetes, high blood pressure, whatever, that we hold for substance use, but we don't hold for the others. And one of them is this sort of, especially for pregnant individuals, basically guilty and an awful human being versus innocent, right? Or no, this is just another chronic illness that we need to address. And so how does that really impact folks? Oh my gosh. The internal struggle that happens. I'm a pregnant individual. I have this baby growing inside me. I'm using substances. I probably know that it's not ideal, but I'm going to get destroyed from the outside, right? I'm just going to assume that every clinic, because this has actually happened, right? A lot of folks come in with not preconceived, but pre-experienced, right? They've experienced this stuff. I'm going to get obliterated by the clinicians. I'm going to get obliterated by hospital staff. I'm going to get obliterated by my family, just across the board, right? So then, I'm going to avoid treatment, or even when I present to a hospital, when they're asking me questions about, you know, this or that, why would I ever? Why would I ever? And then you've got family services that can get involved, which, you know, we try to speak from the mountaintops that really they're looking to keep you together with your child. First and foremost, safety ultimately comes into play, which oftentimes you will find that the individual is in agreement. When you fundamentally get down to it and have a real conversation with someone, they get it.
They understand it.
Wait, you're right. I'm not in a place where I should be taken care of, or I can completely. I think I really do think there's always a place, regardless, right? There's always a place, what that looks like. So then you have that going on during pregnancy and in the hospital. And then afterwards, our systems are absolutely set up. I don't want to call it failure, but should we? Mm-hmm. I don't know. How about limited success? Not the best chance of success.
Sure.
Fundamentally, we
want to say it nicer.
Say it nicer. But really, when you talk to individuals in the community, it's such a common theme. Inpatient. The patient needs inpatient. They need to go inpatient. They need to go inpatient. I'm like, but they have 3 other children, and they just delivered a newborn.
Yeah.
I don't want them going inpatient. What can we be doing for them as an outpatient so they can live the life that they want to live and get all this help and support? I don't know the fix.
And it sucks because even with outpatient, you still can't bring your children to most. Like, that's what I love about
barriers.
Empowered.
Yeah, there's so many barriers.
They break those barriers by allowing you to. When I was in treatment, I couldn't bring my son. This is before I was pregnant with Erie. Couldn't bring my son. So luckily I was blessed enough to have my mom watch him. I would take the bus, MTN would give me my bus pass. I would take the bus all the way down there. If the bus is, the bus systems out here suck. They're always working on any kind of roads. You miss a bus or the bus never shows up, you're late. And once you're late, they didn't play with the treatment. It was one of those, if you use, you're out. If you're 5 to 10 minutes late, you're out. So it was a catch-22, without the transportation, without childcare. How am I really going to be able to do this? And then let's think about work. I wasn't working at the time, but what about those clients who were working? Now they got to figure out work, picking their kids up to and from school, because that's another job in itself. And it just seems like it's
barriers, obstacles. Bianca, what's if there was, you had a magic wand, ready? You've got a magic wand in this world. What do you hit? What do you hit as, let's go with number 1. Boom, you could fix. Ding.
If I had a magic wand, I would ask for 10 more of those things. There's a long list. And as we're kind of having this conversation, I'm thinking about how the system just criminalizes, our mothers that are, if there is a positive test, there's that separation, more separation. Our system is set up for separation.
Yes.
Our system is set up for isolation. And so if I had a magic wand, it would be to magically change that.
Yeah.
And then also I think, there's some incredible research that's out there. Just recently did a listening session through the Nevada Opioid Center of Excellence. And we had Dr. Lindsay present on some innovative or holistic, rather, treatments having to do with nutrition, and taking a look at how, certain nutritional values increase serotonin, increase, the chemicals that address some of the chemical or hormonal, effects, the physical effects that postpartum, brings up. And so when you think about kind of physically how the body is responding during postpartum, you've got a lot of those, the cognitive responses. You've got a lot of in terms of, having trouble with memory, having trouble with decision making, when you're constantly in survival mode.
Yes.
You're constantly in survival mode. When you talk about who's going to watch the kids, how am I going to, transportation barriers, how am I going to get from point A to point B. When we're in survival mode, it's more difficult to identify what are the priorities right now and what is my decision making right now. It's very difficult to exact kind of those constructive decision points, for our mothers. And so the magic wand would definitely go to, more trauma informed, workforce, that we're all understanding that this is the complex nature of postpartum. It would go towards, making sure that the mother is completely supported by a team. I'm a retired, basketball player, and so I'm really huge on teams, right? And I tell the story too all the time. Being a kid playing basketball at the park, in the summers. and lining up everybody on the half court line, and you got 2 captains, and you're picking your team, you know, to create a team that gives you the best chance at winning, right? And so applying that to this, I would love to be able to afford our mothers with, you know, here's a half court line filled with a team, and you pick, you know, who's going to give you the best chances at winning here. But also, I think just the biggest point is integrating, you know, that holistic, total person wraparound care that addresses the multidimensional nature of postpartum and supports our mothers physically, emotionally, behaviorally, all the social drivers, you know, in terms of environment and our housing, in terms of, you know, the quality of life and care, and not only for the mothers, but for the system, because that's truly, you know, mothers are carrying, you know, their entire systems, that they are the rocks of their family. They are the providers, and no matter, you know, they've adopted this culture that I could relate to as an athlete, that I can relate to as being a part of a military family, law enforcement, you know, social services, is that cultural essence, you know, and that mothers certainly carry, that it's you know, excellence, you know, and that's confused with perfectionism, right? And it's integrity, that's your willingness and your abilities to just push through, you know, no matter if you're tired, no matter if you're, you know, exhausted of resource supports, that you just push through, and the service before self, you know, which comes at the sacrifice of self. And so the magic wand would be, like I said, 10 of those things to address, you know, 10 more of those things.
You know, classically, I think that's a genie violation, right? You can't wish for more wishes. Look, I think fundamentally we're all in agreement. I think that would be our magic wand moment as well. I mean, that's effectively why the founders, Rachel, Amani, myself, empowered. That's sort of the premise. Yeah, Rachel, can you expand on what Bianca said? This notion of there's a whole team that does some stuff. What do you want them to do?
Well, I think that's what's really unique about Empowered, is that we heavily rely on all of the expertise of our staff to support our clients. So we have Rachel, who's our therapist and licensed alcohol counselor. We have our peers who have long-term recovery, and have also navigated resources in the community, which I think is really helpful for our clients to be able to have that work with a peer, so someone that's in long-term recovery, to model what recovery looks like, and what everything that goes into getting to that point of being stable in your recovery, whatever that looks like. Everyone's journey to sustainable recovery is different, whatever supports or things that they have in place, but to just show them that it is possible. So we heavily rely on everyone on our team to meet the needs of our clients, really big on collaborating together, showing the clients that we are all working together, so that we're all on the same page, whether it's meeting with clients in a group setting, whether it's making sure that, okay, they're going from this office to the next office and doing that handoff. This is what we're addressing. Can you make sure that they get the clothing that they need for starting their new job? She just had her interview, just all working together. I think that's something we do really, really well at Empowered, is working together and showing clients that even with the resources that they're using in the community, we want to collaborate with them. We want to be able to call them. If they want to come into our office and do a meeting, we can all work together. We do that a lot with child welfare. So our clients that have open CPS cases, meeting with their caseworker, with the client, so that we're all on the same page together, because we're all trying to help them get to whatever it is that they're trying to get to, and that we're all on the same page for those goals that they have for themselves. I think we're really good on collaborating and then celebrating our clients. I have to say that, because I think that's also really important when you're speaking of a team approach. It feels good to be celebrated, to know that you're doing the right thing, you're moving in the right direction, and to have those rewards along the way. Another thing that we do with Empowered, contingency management. We're rewarding those healthy behaviors that they're doing to support themselves and their family. It makes a difference.
Yeah, Amani. So, I mean, you were a recipient, yes. You were on the other side.
Yes.
You've been on both sides and all sides. What was your experience, and how essential was it, or not?
I'm going to be honest. Having Empowered is absolutely one of the best things I could say was the turning point for me in my recovery, because when I started Empowered, I was still using. And so just having that aspect of having, like you said, that whole team just to be there. I would call Miss Quinny in the morning. She was a peer. And I would do my therapies with Rachel, and I could be open about that. And it's not like, oh, okay, well, you can get out this program if you're not going to use, if you're still going to use. And so being able to be honest and open, and then it got to the point, well, why are you using? Well, what was going on? What were you thinking? Learning. Now, I am truly blessed because I do have a family that loves and supports me. They've been there with me the whole way. They took care of my son. Like, they're just amazing. But there's different types of support. And my family and nobody in my intermediate family had experienced a substance use disorder. And so with that being said, it's hard. I mean, we have people who use substances in the family, and you see that journey and struggle. And, your family's like, I don't want you to, grow up or ever experience that. And going from to experience it, they don't know really how to support you, but the only way they do. And sometimes, it's like they're encouraging, but then it's like at the point where, come on now, when you gonna quit? And it's like, I don't know, I'm trying to figure it out myself, So having those different types of supports and those expertise to have somebody to, to love on you and then call you out, or to be able to really help you figure out what's going on so you can get these tools. Empowered since I've started working there has definitely expanded. They have so many cool things. They do house visits, which is amazing because sometimes you're going through a lot and you do not feel like even having the mustard of an energy to get up and out the house. And they will send a ride to your house. Sometimes it takes, I've been there where it's just, I can't even make it in.
Sure.
And they'll come to you to come check on you. And that's another aspect that, you have that
level
support.
Of support.
Yes. And then they can come.
Meeting our clients where they're at. I think that goes a long way.
It does. And then also another thing is you're telling, you go to sessions with their therapists or these peer supports and everything, and you're giving them all these tools to be successful, but yet we've never seen their living environment. So we don't know really what kind of, we're giving them these tools, but is it really applicable?
Sure.
So
Effective,
I love that house visit aspect because you're able to go to the house and, well, maybe we can't do it like this because your house is set up like this, or you have other kids who are asleep, or maybe a significant other that might be doing something. So let's do this routine like this. Maybe we can all stay in the front. It's just having that aspect and that support and love, because sometimes you don't even know where to start. Right. I know it helped me. We started with just a schedule. Amani, wake up by this time. Make sure Yuri has a bath by 7. That's all we gonna do. And try to eat in the middle of the day. Yeah. And that's what it started. And it was like, oh, okay, you want to read? Let's do Bible scripture in the morning. And then let's read to Yuri at the end of the day. Then it was building, and then I started coming up with the routine. Then I'm like, oh, okay, well, I think I want to start working now. Oh, okay, well, now that you have a routine, let's find you a job that can work within your routine. It's a process, but a lot of the times when you're just, I want to be clean, I want to have this life ahead of me, I want this and this, and you're so motivated, and you start piling on, because I'm a piler. I'll stack my plates and keep stacking. And at the time, I was very unsuccessful, and everything would crumble. Then I'm back using again, and so
it's overwhelming.
It really is.
It's overwhelming.
It really is. So having that aspect where it's like, well, let's start doing this first, Then let's celebrate that success, and then let's add this one little by little. Next thing you knew, I was working again, and I had my son back home. It was a blessing, but it took some time. Yeah. It took a lot of time, and it took a support from everybody.
And I think just to add to that, you said that it takes time. We're really thankful for the grant funds that we have to now be able to support clients at 2 years postpartum.
Yes, because I was nervous.
So that's another level of support, is that it's that postpartum period is very unique, and the supports that are needed throughout that time period is crucial for our families to be successful. So being able to support them 2 years postpartum, I think, is another great thing that Empowered is able to do.
Yes. Yeah, surprising. It doesn't magically stop at 6 weeks.
It
6
doesn't.
months,
No,
1 year, 2
no,
years,
Yeah.
sure doesn't.
5
And I'm
years,
gonna be-
15 years.
Yeah.
I'm gonna be honest. I don't know. You know, Rachel, it looks like some of our clients could use a little longer than 2 years.
I know.
Honestly,
Well, that was my
unfortunately.
sarcasm,
Yeah.
right?
Yeah.
I mean, does it ever stop?
You know, I think recovery, healing, it's something that is every single day, you know, and multiple times throughout the day. And as I mentioned, you know, throughout this conversation, you know, when we talk about perception and just the power of influence it has over our experiences, you know, as mothers, as family members, and as the system as a whole, when we talk about thoughts, the human brain has more than 70,000 thoughts, like on average, right, per day.
That's true.
And but then when we talk about marginalized communities and survival mode, when we talk about neurodivergence, you talk about exponentially, you know, more thoughts per day.
Yes.
So that 70,000 plus, it's actually, you know, those are decision points, individual decision points every single day to heal,
every single day.
right? To receive without permission, you know, to receive or to embrace those opportunities to heal. And so to answer the short answer, yes, it happens every single day. This work never stops. And then it's every single day, multiple points throughout the day. And I think it's important for us to understand, you know, from a professional standpoint, you know, and from an advocate standpoint, this is the fastest growing population of substance use disorder is pregnant women.
Yes.
You know, our birthing mothers, the fastest growing population for substance use disorder. And so it's going to require everybody. And what I loved about what you said is peers involved.
Yes.
We've got to, you know, to me, we've got to empower and honor lived experience in this space, you know, because the peer work is where we really get to see you know, the best outcomes, of course, but just the greater connections. Because if we are all in agreement that connection is really kind of the cure here,
Yes, it is.
the way to relate to somebody else who perhaps looks like you, lives, you know, like you, has that same language or that inviting language that can co-create, that's willing and able to co-create these safe spaces to be able to share our journeys and our stories and that shared language. That's powerful. That's powerful. And so we've got to continue to, the grant funding is amazing because I always say it always comes down to money, right? But we've got to continue to build up these programs, support these programs that involve peers and lived experience.
Yeah, I'll look along those lines. We're hitting the home stretch here. For me, I sort of hold peers in this category of like new, that's non-traditional, and innovation. They've been around, but we haven't really adopted. But now we're trying to. Anything else in your world that you want our listeners and viewers to hear about? What is something that's kind of at the forefront, is innovative in this space? If they're in their communities, they could ask like, hey, can I have access to this, that, whatever it may be? Anything along those lines?
Gosh. And sometimes it's so difficult to just kind of refine that list, you know, because there's so many gaps, so many holes.
Yeah.
For me, I return to kind of the genesis is I love lived experience. I love peer supports. I also love, you know, integrating into the conversation nutrition. I think that,
nutrition.
you know, I'm a huge proponent is everything that we consume, you know, is influencing, you know, those many decision points, is influencing us on all those domains. Anything that we consume in terms of, you know, food, nutrition, substance, because we're talking about substance use disorder, right? So we've got to take a look at the substance that all substances that we're consuming, right? And then also, you know, messages, energy, things like that. So when we talk about environmental influences, what we're watching on TV, streaming, what we're binge watching, what we're, you know, these are all, you know, familiar patterns, right? When we talk about everything is broken down into relationships, and if we have toxic relationships with one thing, then we're more likely to have toxic relationships with substances, right? And so it's where can we go? We can go into our community, into the collective, into any member of our team that we've identified, and we can. You know, I would say a one-stop shop is kind of like the ideal, you know, having a hub to where you could be able to gain that support, to challenge and to protect all things that we're consuming. You know?
Yeah. I just to pivot a little bit, I want to sort of plug one innovative. It's something called the collaborative care model. Have you ever heard?
Yes,
Yeah. So
yes.
that's what we've implemented at High Risk Pregnancy Center. Effectively, for those of you that are not familiar with collaborative care model, it's a very one-stop shop. So your clinician is your one-stop shop. So at high risk, if you're seeing a maternal fetal medicine specialist and you have diabetes, you have high blood pressure, you have something going on with baby, you have depression, bipolar, substance use disorder, that same clinician takes care of everything and attempts to address everything. It's called collaborative care. I really see it as sort of the wave of the future when it comes to providing that's traditional physical and mental health care, yes,
Sure.
which involves things like medication, but we do not have enough clinicians for traditional care, which is, you have depression, let me refer you to psychiatry. There are not nearly enough of me's because we're thinking conservatively 25% of Americans, but probably more like 33% have a mental health issue.
Yeah.
Yes.
And so that means you need millions of me. Not going to happen. So this is allowing folks to sort of get that integrated care. It's innovative. So listen, now, it's been around for a long time, has a huge evidence base. We're still the only practice in Nevada that's doing this.
Wow.
And that's another mountaintops. Please try to integrate this into primary care.
Yeah.
Please try to integrate this, all those. So yeah, there's my plug. But Rachel, I think you were going to say something.
No, you all do amazing work there, and I agree that model should be transformed in other areas throughout the community because the outcomes, you can see the outcomes that can come from that.
Yeah, and look, I mean, I'm going to call that tip of the iceberg.
Sure.
Bianca, you outlined so many other things that are needed. They are absolutely needed.
Yeah.
Things like nutrition. That when I see individuals, I absolutely talk about things like nutrition. I mean, you could break it down to there's an engine, doesn't need gasoline, and what kind of gasoline you're going to put in this thing, on and on. But that's part of it, right? And then you mentioned the other big piece that I talk about is this notion of connection. What's your social, like, what does that look like? Then, I have a couple other things like traditional therapy, traditional medications, and mental health care. But the list goes on and on and on. There's activity. I'm going to throw that in there as well, the way you move your body. And there's evidence to support all of this.
Yeah.
But we are so far behind, right? We're so far. We're like, what, a decade, maybe 20 years? Because things go so slow.
Yeah.
Things go so slow. So.
And something else just to add to that is I'm also a huge believer that opportunities to contribute. I think this is a human desire across the board is that our perception of our own wellness, of our own happiness is really based on how much can we contribute and take care of ourselves, of our children, of our families, of our community. And people that lack the opportunity or the perception that they are contributing, they have a purpose, are more likely to fall through these cracks. Even if we have the resources available, the utilization of resources is still another barrier, right? And helping people navigate these systems. But all of those, we're going to continue to see kind of the same outcomes, the same statistics, if we are not taking a look at and assessing. I think it's screening and it's assessing. It's having conversations like these with our mothers and finding out what is the level perception of contributing, right? And how can we create opportunities and activities where there's successful, we can identify successful milestones. We can identify how they are contributing to their recovery.
Yeah. That goes back to the 4 dimensions of recovery.
Exactly.
Were you going to say that? I had to say it. Because that's what we focus on: community, health and wellness, stability, and purpose.
And purpose.
And for a sustainable recovery.
Contribution. Yeah,
we call that an assist in basketball. I just threw an assist.
Right.
I love it.
Look, we're basically out of time. Bianca, I want to talk to you for 19 hours on the short end of the side.
I could do that.
Look, this was an amazing discussion. Thank you for all that you do.
Thank you.
If I had a magic wand, I'm replicating you. 10 times
Yes.
so that you can impact more folks. Why is this so critical? Because it's the number one cause of death for reproductive age individuals in this country, not even close. So we're talking about the most serious thing, I would argue the most important thing if we're trying to keep people alive. And then let's move past alive and get them to well. Let's move past well and get them to thriving,
Yes.
right? Beyond
Yes.
surviving.
Yes.
Yeah, thank you.
Yes. Well, thank you, Bianca, and thank you, Rachel, for joining
so
us
much.
today on Empowered Voices. Thank you for listening to Empowered Voices. Please be sure to subscribe, rate, and share this episode. Join us in 2 weeks for episode 6, where we will be talking about the intersection of substance use and human trafficking. As always, we also encourage you to visit our website, empoweredmoms.org, to share your thoughts on this episode or suggest topics you'd like to hear more about.
Thank you.
Amazing. Thank you so
Thank
much.
you. Thank you. If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or in Weber County or Davis County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance required. Visit empoweredmoms.org for information or to request services. If you live outside of these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Raw, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.